It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Candace Kruger along with Jim Knox back again with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that have helped change people's lives.
And speaking of best, we're going to start off with one of the best plastic surgeons in the Houston area. It is Dr. Michael Eisemann.
People who typically see me are people either have a nasal airway obstruction problem or those who are concerned about the appearance of their nose.
I had rhinoplasty done. I had a bump in my nose, and I had fallen in a store and it had swollen up, so I came to see Dr. Eisemann to make sure it wasn't broken, and it wasn't. But then we got to talking about my situation, and he told me that he could repair my nose for me.
We do an internal exam and make sure there are not other problems that have to be addressed as well, such as sinus problems, septal deviation problems, scarring from trauma, or even some congenital problems that interfere with breathing.
I've had chronic sinus problems throughout my life, and Dr. Eisemann said I had a deviated septum, and he also repaired that during the surgery. And since then, I hardly have sinus infections anymore. I have much better health.
It's about an hour and a half to do the operation, about an hour in the recovery area, and they go home. They have some packing that's in there overnight. Taping and the dressing is to get the skin to recontour, because we're working on the bone and cartilage, and the skin has to redistribute itself and adhere to the underlying cartilage and bone so it redrapes properly.
As far as recovery, he gave me an outline and directions with it. He also gave me a list of possible problems that could result from any surgery. So I was well informed, and I was prepared for the procedure and the outcome.
This is her post-operatively, her pre-operative pictures. This is probably about 2 months after the surgery, which is generally when we take the post-operative pictures, and then we have them come back, in a year later also. My health is better, and I just feel better about myself because I know my nose has been repaired, and I like the way it looks now, and it makes a huge difference in your life. It's probably one of the most common operations, but also one of the most difficult ones too. But it's a wonderful operation, and it has such a dramatic change in someone's appearance. Very dramatic for the patient, and very rewarding for the physician.
Probably for the better part of 10 years, when I would cough or sneeze, I would release urine.
The leaky bladder is extremely common, and I think one of the biggest issues is that women just don't like to talk about it. They think they have to put up with it, or they're somewhat reluctant to talk about it in the office to their doctor. It finally got to the point where it was interfering with stuff. I had to carry extra underwear and clothes to work, or I'd have to go home in the middle of the day, and it was I don't think anyone ever noticed, but I felt embarrassed and uncomfortable, and that was what finally made me decide to get tested to see if my problem was due to the incontinence that this would fix. The procedure now is also a minimally invasive procedure, and it involves placing a small piece of mesh underneath the urethra. That's the tube that goes from the bladder to the outside, and it forms just a hammock or sling underneath the urethra, and when placed correctly, it has an over 90% chance of success. After I had it done, I told Dr. Leibman I wish I had done this 5 years ago, because it made that much of a difference. But I thought I was too young, and so I convinced myself, oh, you don't have this, it's something else. This isn't going to fix your problem, and so I just didn't
ever talked to him about it. So I should have talked to him sooner.
The recovery is also just wonderful. It's done as an outpatient. This procedure is still done as an outpatient in a outpatient facility or freestanding outpatient clinic. And the patient will go home, again, have something to eat, maybe take some pain medicine, but very little discomfort associated with it.
I sneezed, nothing, not a single drop. And it's been 2 years now. I mean, it's completely changed my life.
Very little discomfort associated with it. And what's really nice about it is that it's effective immediately. If it's going to work, she'll tell you the next day she hasn't leaked, much to her surprise.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
Went to a walk-in clinic one night. They told me I was having a heart attack. Sent me to the emergency room. It wasn't a heart attack, but they did run the test. The cardiologist told me that I had slight blockage. He said, you can save your life by having that surgery that you're scared to do, or you can be dead within a year.
She had high blood pressure, high lipids in the blood. I think she had some asthma, chronic back pain, depression. I mean, these are all comorbidities, we call them, of obesity. And her weight was out of control and going in the wrong direction, and she was heading for a big problem.
So I contacted the office, and my son and I did it together. We actually came to the seminar. He did his first, I did mine second, and it's been a little over 3 years.
A gastric bypass is where we create a small pouch of the stomach at the top, and then we bring some intestine up and hook it onto that pouch, bypassing the majority of the stomach and the very first part of the intestine.
I can eat pretty much anything. I have to watch and maintain for the rest of my life, because this surgery gets you to the low point of your weight. Then it's up to you to maintain it and take care of it for the rest of your life.
Well, she was 330 pounds before she started. I think she's 148 pounds now. That's a significant weight loss, I think, in anybody's book. And that's not atypical for a gastric bypass. That would sort of be what we hope for and expect, and she's well within the bell curve of our outcomes.
My advice would be, it is a life changer, but I did it to save my life. Some people want to do it to be vain. I didn't. I wanted to save my life and live a long time because I had kids.
Nobody wants to have an operation. It's not fun, it hurts, you miss work, but the benefit to be gained is significant, and the change in life is significant, and once the patients start to move in the right direction, their whole attitude usually improves quite a bit, and they're much more happy.
It gave me energy. It has inspired me to be and do more than I thought I could ever do in my life.
How do you know if the chest pain you're having is due to a heart attack or something that's not quite as serious? That's an important question. First of all, chest pain that's due to a heart attack is usually dull, not sharp like a knife. Usually comes on gradually, not suddenly. It's usually moderate, not severe, not mild, and often it will radiate to your left arm, into your neck, and is often accompanied by a cold sweat. Sometimes you'll become nauseated, sometimes you can become short of breath, and generally you just feel bad. People find themselves getting pale. Those are the symptoms of a classic heart-type pain that may indicate a heart attack is beginning to happen to you. There are other causes of chest pain that aren't nearly as bad, but those are the ones that are accompanied with heartburn and don't have the typical symptoms that I've just described.
Every woman is, a little bit different on one side than the other, but after I got pregnant and I had my daughter, I was breastfeeding her, and she would only take from one side, which was my left side. I guess because of that, it made that side so much smaller.
Mandy came to us initially asking for breast augmentation, and after doing an exam and taking photos, it became obvious that she had a really big discrepancy between her breasts. And after further questioning, she told us that she had to wear 2 bras and was putting something on the other side to balance it out. And there was a large difference. And it was a confidence issue. It was a clothes issue. It was being able to get into a wedding dress that fit issue. And so there was a lot more going on than just a simple breast augmentation.
Probably an A cup, maybe a small B on the left side, and then on the right side I was like a full C. And so there was a huge difference there, and I didn't feel comfortable looking at myself in the mirror. I couldn't find bras to fit.
And I said, I'm here to make you happy. I'm going to take care of you, and we're going to do everything we can to make you happy. And she did indeed need a lift. We put in different size implants to account for the different sized pre-existing breasts.
The hospital staff was wonderful. He was wonderful. He made me feel completely comfortable, explained to me, exactly what we were going to do and what was going to happen. And
it's not just about the size of the breast, but it's the confidence and the balance, that she's no longer thinking that people are looking at her and noticing that she has 2 sports bras on, or noticing when she goes out and is doing something that her breasts are uneven.
I'm getting married on Friday, and I had, there's healing and, all this process you have to go through, and I wanted to be completely healed. I wanted to have no pain, and everything like that. So that's why I chose to do it a few months in advance.
Everybody has subtle differences, but some people have more than subtle differences, and that's where a procedure like this is perfect, where it can correct those differences and really help people have confidence and self-esteem to know that they are filling their clothing out that's designed in a certain way.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, earetics, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
For more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com.
That's the place to go. And Candace, it is October, and that is Breast Cancer Awareness Month, and our next doctor actually helps detect and prevent that disease. It is radiologist Dr. Stephen Rose.
To be a comprehensive breast center, it doesn't mean having a nice building and a nice name on the center. There's a lot of people that have done that. What makes you a comprehensive breast center is working with other physician specialties together to do the best that you can possibly do for each patient. It's important that when we find an abnormality, that the radiologist understands the pathology, knows what to biopsy, when to biopsy, and then can communicate that back to the referring physician, communicate it to the patient, and communicate to the pathologist what our concerns are. This is what the beauty is of a comprehensive breast center. So it really means working together as a team, working with your breast surgeons, working with the pathologist, working with the radiation oncologist, the plastic surgeons, and we work as a team. When people come to TOPS Comprehensive Breast Center, or if they come to one of our Memorial Hermann breast centers, what they'll see is a group of dedicated breast radiologists. So when they come to one of our centers, they're dealing with a radiologist who is focused on finding cancer at the early stage. And one of the things that we talk about as a group, we want to disrupt as few lives as possible while finding cancers at their earliest stage. That's our mission statement. If someone comes in and then we have a finding on the mammogram, or they come in with a palpable lump and they need an ultrasound. In many facilities, this is performed by a technologist. The doctor may or may not ever see the patient. If they do see the patient, they only look at the area of interest. It is our policy and our practice that the radiologist comes in on every patient. We scan every patient ourselves. Yes, our technologists look, but we scan every patient. My strong belief is, and I think statistics prove that, is that when you have specialists doing this, you get a better result. In our practice, that's what we do. That's the whole focus of our practice. You know, it's a very special group of people from all over the country, from very well-trained facilities, and so it's an exciting group to be part of.
Kimberly, who loves to travel due to her job, could hardly walk due to severe foot pain until she met Dr. Gabriel Maislos. To find out more about Kimberly's story and other life-changing stories, log on to bestdocsnetwork.com.
Hair loss has many causes. 90% of hair loss is the genetic type that we see men balding. Females will get it as well. A small percentage have immune-mediated hair loss and scarring hair loss. We do a lot to try and screen those patients and treat them in other ways because they can't be candidates for this procedure. Well, FUE is the extraction of a follicle unit one by one. It involves careful aiming of the device at the unit and extracting it one by one. It's very time-consuming and tedious, but done properly, it allows for great healing and great results. Again, the other method is a giant scar, ear-to-ear incision, very, very bloody and fast. It's fast and easy, but it's just a horrible thing for the patient to go through. Versus this method is much more delicate, intricate, and overall the results are great. If you're talking about FUE and it's something you're interested in doing, you need to have at least a good amount of area in the back of your scalp to donate. It's the same criteria as the strip surgery criteria. Important things are things you shouldn't have or should try, or if you're considering, you don't want to be a patient with a lot of medical conditions. You can't really be on a blood thinner, you can't be a diabetic, you can't really have thyroid disease. Now, that's not to say that if you have these, you can't do the procedure. There are people who have these conditions and do the procedure, but your odds of success are much lower. In general, you want it to be an overall healthy person who undergoes this procedure. It is elective, it is cosmetic. The recovery time for this procedure is dramatic compared to the other procedure. The other procedure, you'd have this giant stitch that was painful and would stay in for 2 weeks. In this procedure, usually you have a Band-Aid on the back of your scalp. Band-Aid comes off in a day, maybe 2 days, and you can go back to work the next day. If you're okay with the Band-Aid, a lot of people are. They just get a Band-Aid, go to work the next day, and it's like nothing's happened. There are other ways to do this. They're not permanent. Whatever you do, you're going to do it every day versus our method is permanent. But we like to make sure the patient's informed about their options before they actually undergo this procedure. Now, once you do this procedure, you're done. There are no pills, there are no creams, there are no topical medicines, and you have your hair. You go swimming, go do whatever you want with it.
Many present in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think probably about a year And so it had got so bad I couldn't even wear a shoe. So that's what really made me came in, you know, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better. You know, no pain. You know, it just felt better. And I was so happy, you know, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, you know, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump because first it gets red, and the next thing you know, you have a wound. And that can be problematic because then you can get an infection to the bone.
I mean, it's not sore or nothing. It just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. You know, a lot of people are concerned that they've heard from their neighbor or they know someone at work who's had the surgery and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really, 2 weeks of just not putting weight on it, and you know, we've really come a long way with our surgeries.
Tiku broke his jaw growing up and his teeth never lined up until he met oral surgeon Dr. Paul Metz. To find out more about Tiku's story and other life-changing stories, log on to bestdocsnetwork.com.
Well, from the standpoint of non-invasive treatments to the face, such as the Botox, that helps reduce the wrinkles. So you want to prevent them before they actually establish them themselves long term. So that's what the Botox is going to do. It's going to paralyze those muscles that cause the wrinkles. Therefore, you don't get the wrinkles.
Botox is more for like the fine lines that I have around my eyes or my forehead, or especially, you know, in the zone where we make the little snooty face. And over time, you know, the creases get worse.
In addition, anybody who has the aging process, which is the natural creases or folds in their face, that's where the filler can come in.
The filler I come in for my lips, just to soften the area right here where it starts to wrinkle. That didn't happen until after my mid-30s. I started getting a little fine lines around my lips. So she came in, it's really not to have big lips, it's just to soften this area. And in my folds right here.
There are different types of fillers on the market now. The most common is a hyaluronic acid type filler, which means it is a protein that's normally found inside the skin. And by injecting this type of filler, it attracts water to the area and therefore plumps the area out.
If I get a Botox procedure, I can come in on my lunch break. It's very quick, I can go back to work, I don't look crazy or weird.
Anybody can be a good candidate for Botox and fillers as long as they're not on any blood thinners, okay? Or if they have any allergies to any specific medications, such as the Botox or the fillers.
I believe the non-invasive route is the better route. And if that doesn't help, then you may have to have some type of plastic surgery done. But there's all kind of things that you can do now between the lasers and the chemical pills and really good products and injectables. I believe that you can do a lot and you don't have to so far go as far as getting cut on. Mine is to really look refreshed and, you know, nice. I'm not trying to look 20, I just want to age gracefully.
Well, Keith came to see me because he was having recurring sinus infections and facial pressure and ugly drainage out of his nose, and he seemed like he was sick all the time.
And like I said, I travel to China an awful lot, and it's a pretty exhausting trip, and I would inevitably end up getting sick, and and it would last for 2 or 3 weeks. And
we're designed to breathe through our nose, right? We're not designed to breathe through our mouth. Air comes in the nose, it gets warmed,
humidified, cleaned. That's why if you breathe through your mouth, 2-3 breaths, you already feel it desiccating, getting all dry in there, and you want to breathe through your nose. So I always tell patients, you have 2 patients, both have allergies. This guy can breathe through his nose and this guy can't. Who's happier? Everybody knows the answer. Anyway, so he was having these complaints, so I looked at his nose. He supposedly had a previous septal surgery, but he still had a bad septum, and he supposedly had previous sinus surgery, but so just because you've had sinus surgery doesn't mean you've had all of your sinuses addressed, if indeed they all needed to be addressed.
A month later, I was feeling better than ever, and actually it took out a bunch of polyps from my nasal cavity up in my forehead. That I used to get sick anytime that I was extremely exhausted, and I travel a lot, and every time I would get sick. And since then, I hadn't been sick.
What I find is patients who have had sinus surgery and they've had like some miserable post-op experience, and then on top of that, it didn't even work and they're still sick. They're like, well, I've already tried that, it didn't work, and it was miserable recovery, and I'm not doing it again. And so they live like the rest of their life with recurring sinus infections and chronic congestion.
All the technology he's got that he can show you, look, this is what happens, and it's kind of interactive type deal. And I can't speak for somebody else with similar issues and how bad their situation is, but it worked for me.
And I love those patients when they finally come in to see me, because I teach them, like, look, you've had surgery, but this is what was done. And this is where you are, and if we fix this area, you won't be like that. Keith is just that patient who's gone through it once with a bad outcome, and now is very happy.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in 2 settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a 3-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that have helped change people's lives.
That's right. For more information on any of these great doctors you've seen on today's show, head to the website, bestdocsnetwork.com.
And as always, if you have a question or comment for us, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.